If you have been struggling with hair loss and you feel like all the medical treatments, the nutraceuticals, and everything you've been trying just isn't working enough, you may want to consider hair transplantations. I'm Dr. Alice Mina. Welcome to the Skin Reel. On this week's episode, I'm thrilled to have hair restoration surgeon Dr. Ross Kopelman joining me. He is going to be diving into the world of hair transplantation surgery with me and going over what it is, how it's actually performed, and what you can expect if you have a hair transplant. And spoiler alert, you have got to be patient. When you're talking about getting a hair transplant, it is playing the long game. There are no quick fixes with this. But I learned a ton. Dr. Kopelman practices at Kopelman Hair Restoration with his dad in New York City. They also have an office in Palm Beach. And he is going to let you know what you need to think about, what you should be doing, and what you shouldn't be doing if you're thinking about having a hair transplant. If you are considering a hair transplant, you definitely want to listen to this first. Dr. Kopelman, thanks so much for joining me. I'm really excited to have you on because I have not actually covered hair transplants yet. And so this is going to be really exciting.
Well, that is a big surprise because hair loss impacts a lot of people. So I'm excited to be your first guest on the show to talk about this topic. So it's a pleasure to be here.
Yeah, I feel like some dermatologists do transplants for sure. And we certainly treat hair loss. But then there comes a point where it's like, well, what next? What are the next steps? And that's usually to go see someone like you who does hair transplants. But I would love to just have you briefly tell us what you do and what your practice looks like.
Yeah, so of course. I'm a hair restoration surgeon. I practice in New York City. I have an office on Park Avenue and also in Palm Beach County down in Florida. And a lot of my focus on a daily basis is to educate patients about hair loss because patients think about hair transplants as kind of the first stop for hair loss, but that actually is not the first stop. The first stop is to really think about medical treatment. And so a big drive of what I'm focused on is education because I do believe that if we can educate a younger audience sooner about the issues around hair loss, well, maybe they will never need a hair transplant. So that is a little intro into kind of what my focus is in terms of what I do on a daily basis.
I couldn't agree more, right? And hair loss, I used to think it was just something men dealt with. And then I started feeling like my hair, I was seeing more scalp than I was used to seeing. And I was like, wait a minute. And my friends are like, wait, we're thinning and all that. So it's really something men and women struggle with. And it's equally frustrating for both. And yeah, figuring out that there's medical treatments, nutritional things to think about, make sure there's no medical conditions going on. Hair loss isn't like, oh, take this pill and you'll be cured, right?
Absolutely not. It's really a lifelong commitment to address your hair loss. It's not like taking care of an acne pimple where there's sometimes a quick fix or maybe a couple of months. With hair loss, whether you're taking vitamins, oral medications, it's a commitment. And a lot of patients are a little upset actually when they find out that there's not kind of a quick solution. And some patients are anti-medications. So it's a frustrating position to be in as a clinician who wants to take care of hair, knowing that there are some patients who are not going to be that compliant with the medical therapies that are out there.
I totally hear that too. People will say, well, I don't want to start if I recommend an oral medication. I don't want to start it if I have to take it for the rest of my life. But it's kind of like working out, right? It's not like you work out for a month and then you get the body you want and then you stop, right? It is a commitment to be on it. It takes time. Hair growth and regrowth takes time. It's not overnight. So these are things, if you're going to start on this journey, right, it takes months to see the progress and sometimes trying different things.
You know, the best analogy that I use with patients tends to work really well is I say, it's like getting Botox. It works for 3 months. If you stop it, the wrinkles come back. And it's the same thing with hair. And then they get it. They just understand that, you know what, there's a level of commitment that's important for this to work. And if you stop, it doesn't work. This goes back to the first thing I said when we started this conversation, which a lot of what I do is education because A more informed patient is going to be a more compliant patient in terms of being on treatment. And those patients tend to get better results. And then if they get better results, I look better. So
That's right. It's a win-win for everyone. They need to have buy-in, right? It takes a financial commitment, a time commitment. And yeah, I totally agree with you on that. Well, let's kind of talk about what is a hair transplant, or you said you're a hair restoration expert, right? But like specifically transplants, what is that? And I find it funny that people think that's the first stop because in my mind, that's like the last stop.
so let me explain why I use the word hair restoration surgeon. It's not only about hair transplants, right? First and foremost, the success of a hair transplant is a patient being on some form of medical therapy, whether that's oral medicine, topical, something that's organic, whether it's PRP, mesotherapy. Those treatments are important in parallel with the success of a hair transplant. Now, what is a hair transplant? What does it entail? Well, I know that you spent some time studying hair, especially during your residency. I know you're a dermatologist, and I'm sure you see a lot of hair loss that comes into your office. I don't know how much hair you treat, but I'm sure you treat some hair. The hair in the back of our scalp is less sensitive to a hormone known as DHT, dihydrotestosterone. And so the fundamentals of hair transplants are that we can take hair from the back of our scalps and we can transplant that to the front. And that applies to both men and women. Now, women are a little more complicated. There's some underlying medical conditions that make women hair loss in women a little more challenging to treat. But typically, that is kind of the basis of a hair transplant. We take hair from the back, and there's two different approaches. And by the way, interrupt me at any point. We can go into each one.
I was hoping you'd break it down.
So there's two different approaches. There's the FUT approach, which is follicular unit transplantation. It's taking a strip from the back of the scalp and then you kind of zipper it up like a zipper. So imagine opening a window and you zip that up. That's one way to extract hair. And the second way to extract hair is with a little instrument. Now, this is a pen, but you take a little instrument. It's called FUE, follicular unit extraction. We take units, small units of hair. Either in these units, these follicular units are made up of 1 hairs, 2 hairs, 3 hairs, and sometimes 4 hairs. So those are the two approaches. But in both cases, those hairs are then looked underneath a fine microscope and they're kind of cut down and shaven down. And sometimes we take threes and we make twos or ones out of those hairs. And then we transplant that hair to the front. And so, you know, what's so interesting, Dr. Mina, is that, hair restoration is a fairly new field. What I mean by that is the innovations in this field have been rapidly changing just in the past decade. So 10 or 15 years ago, Dr. Rassman and Dr. Bernstein wrote some of the foundational papers just on FUT. And FUT for a very long time was very popular, where we would take a strip from the back of the scalp. And then, people started to get fearful of seeing these scars that get splashed all over Google. And they think, oh, FUT is not a good approach. So then we saw the rise of FUE, and FUE is where you take these individual hair follicles. But there's a misconception because the misconception is that FUE is a scarless procedure. And in fact, it's not a scarless procedure. You're taking all these micro dots, and in some cases, you're doing thousands of little micro dots. So you can imagine that you can get hypopigmentation in the back of the scalp. So no surgery is without its complications. No surgery is without the possibility of having a scar. And what's interesting now is it's only been about 15 years since FUT was introduced. And now FUE has ellipsed FUT. Okay. So about 74% of hair transplants in the world now are FUE procedures. But I'm actually in the camp that is not a good thing. I think a great hair restoration surgeon, a great hair transplant surgeon needs to know how to do both approaches. And I'm going to go through why.
And my view too was, FUT was sort of the old way to do it. FUE's the better, less scar. I've seen the scars. I find if you have a little bit longer hair, it covers better. But if you have a very short hairstyle, then that scar can be noticeable. But yeah, I love how you're breaking this down for us.
Let's talk first about some of the benefits of why is FUE so popular? Okay, and FUE is so popular, and I think you alluded to one of the points is that individuals who have short hair benefit from having FUE approaches because if they and my hair is not even considered short. So if the hair was really, really short, you would possibly see that linear scar in the back. And by the way, the scars are not as bad as people imagine because we do what's called a trichophytic closure and the hair grows through the linear scar. So actually a year after doing a FUT procedure on a patient, I have a very hard time actually finding that linear scar. So FUE does have a role to play, absolutely, if you have short hair. But then I'm in the camp of if you're a female, like yourself, doctor. I mean, if you were ever, by the way, you have beautiful hair. You don't need a hair transplant.
What are you saying, Dr. Kopelman?
But if you were ever to go for a hair transplant, let's say you needed a hair lowering procedure, you wanted to work on your widow's peak, maybe you had a wide part, we'd have to take thousands of hair follicles from the back of your scalp. I'm not quite sure that you want me to shave such a large window because when we do FUE, we have to shave the back of your scalp.
I didn't know that. I did not know that.
I don't think you would want us to shave that wide window. So for female patients, it baffles me how there can be FUE only hair transplant surgeons in the world because half the transplant patients are females, believe it or not. Even though we think this is a male dominated world in terms of transplants, that's not the case. So, when I see numbers, I know these numbers because I was recently on a lecture, a webinar for the Hair Restoration Society, and they talked about these numbers. And I brought up this discussion, which is this is almost terrible that FUT is quote unquote, some people would say it's a dying art. It's not spoken enough at conferences. But the reality is we need FUT because there are a lot of female patients that benefit from it. I only perform FUT on female patients unless it's a very small area and I need only a few hundred follicles. But if I'm taking more than 300 or 400 follicles, it's absolutely going to be a strip.
I can tell you, I would much prefer you to take a strip of skin back here that would hide, my hair would cover it, than have to shave a large section and watch that grow out over 5 years.
Yeah, absolutely. So, without going into too many details, there are two approaches to hair transplants. I'm in the camp that both skill sets are critically important. And if someone's looking for a hair transplant surgeon, and I'm not encouraging people necessarily to come to me, because I always think that if you're going for a hair transplant, you should always go to someone who's local because God forbid there's complications, you need follow up, you need to be in an area. And there's great hair surgeons in every part of this country and around the globe. But ideally, you should look for someone who has the skill set to perform both.
That's great to hear. I think sometimes in really anything, but in medicine, because that's where I am, right? Like we find something new and exciting. It doesn't mean that what we were doing is no longer good just because something else came along. So, well, that's really interesting. I had no idea there were that many women getting hair transplants. I mean, I'm really shocked by that. When women get hair transplants, are the transplanted hairs short or can you transplant the length of their hair?
There's a technique called long hair FUT, FUE. This is where we don't shave the hair completely down. The long hair approach, it's not necessarily as long as your hair is now. It's a little shorter than that. It's ideal if we're performing eyebrow hair transplants because then we could see the curl and how it lays over the eye. And I perform a lot of eyebrow hair transplants. So that's why female hair transplants are very popular. It's not just about fixing the scalp, it's also about eyebrows. And so there's certain benefits there. But regardless of performing long hair or short hair, I don't think it really matters. And I'll tell you why. The hair is going to fall out after 3 weeks. So why go through that tedious process of doing long hair FUE when we know that those hair follicles are going to fall out, the seeds are planted, and then it takes 6 to 9 months for the hair to grow in. It's just an added complicated step. But regardless, we do perform long hair and we find it's beneficial for certain procedures like eyebrows. And also if a patient, for instance, is getting married in 2 or 3 weeks, then they're getting an emergency hair transplant.
That's pretty risky.
That's risky, but it happens. But yeah, so those techniques exist and there are people in the field that are always pushing those approaches forward. But ultimately, at the end of the day, I don't know how much it benefits doing long hair versus short hair.
Yeah, if it's going to fall out. So, can you walk us through what's it like? So, if someone comes in for the treatment, it sounds like it's a pretty lengthy day for them if you're doing scalp or taking thousands, right, of those units. Like, what's sort of the typical progression for someone who's having a transplant, what they can expect when they see results, stuff like that?
So, first and foremost, if you're going for a hair transplant, you should be on medical therapy beforehand. So, either a combination of oral minoxidil and a DHT blocker, dutasteride or finasteride. That's just important to make sure that when you come in for your hair transplant, your follicles look great and luscious and beautiful. That's number one. Number two, this is the fertilizer for the hair. Okay. The next step is the day of surgery. Patients in my office, they get a Valium in the morning. We spend a great deal of time designing, and we do this process during the initial consultation. But the success of a hair transplant is not the extraction, actually. The success of the hair transplant is the design and the implantation of the hair follicles. So that's a critical, critical step. And the other thing to emphasize is this is really a team sport. This is not only performed by myself, this is also performed by a team that surrounds me. So I have a team of hair technicians that work with me. I have a nurse. So there's a lot involved. This is a very, very long procedure. It takes about 6 to 7 hours to perform a hair transplant successfully. So you come in, we spend a lot of time doing design, whether it's your eyebrows, whether it's a hair lowering procedure, whatever the case may be. We then mark out where we're going to take care of from the back. If it's an FUE, we're going to shave the back of the scalp. If it's an FUT, we're going to kind of box out the area that we're going to take that linear strip from. And then we give you a medication to make you feel comfortable during the procedure. And then the extraction starts. And again, it's one of those two approaches to extract. And then after that, we do site creation. And the site creation is vitally important because it's how the hair lays. So when I look at your hair, Dr. Mina, your hair goes to the right, it goes to the left, it has a part. You don't want to just make sticks. You have to really artistically look. This is a very artistic process because otherwise it's not going to look good and the results are so critical. But what is very important is handling these hair follicles. These hair follicles are living cells. They're being taken out of the body. It's almost like doing an organ transplant, but on a much smaller scale. And you have to take these hair follicles and be very delicate with them. You have to preserve them in certain preservatives so that the ability for them to live is prolonged. And your team has to really be great at implanting. So basically, I go in and I dig the holes when I make the sites on the digger, but I'm designing the garden. Okay. And then the planters come in and they plant. And then after that, it's a recovery process. I think one of the most frustrating things for me, and it's not only for me, it's for the patient, is that I have to be patient. I don't get to see my results. It's not like doing a facelift.
Yeah, it's not like, "Come back in a year and we'll check it out."
It's not like doing fillers. You don't see the results immediate. You don't see it in 2 days. I have to wait 6 months, 9 months, a year to see results. And so a big part of, what I have to do is I have to coach patients on that. And so you should absolutely expect swelling after a hair transplant under your eyes, your scalp. You can't wash your hair for a couple of days. And then all that falls out. And it's very common for a hair transplant surgeon to get a phone call from a patient 3 weeks later. Hey, my hair transplant didn't work. And then you have to remind them, hey, remember the leaves fall out, the seeds are planted, and you have to be patient. So
I bet that is probably frustrating for all, right? Because you're excited to see the results and they get a little taste of it when they have the hair put in. I can see how that would be kind of frustrating for everyone. And you had mentioned you can't wash your hair, right? I was going to ask that. Like, it sounds like you don't want to wash out the new seedlings, right?
yeah, so for the first 72 hours, we don't want you to wash your scalp. After that, you start to use a small bucket with some baby soap or antibacterial soap, shampoo, and you kind of lightly kind of wash away any of the blood or the scabs that are building up. And about 10 days later, you can go into the shower, stand with the shower head in the back of you and allow the water to drip down. And then within 2 weeks, you're kind of back into your normal routine. So there's certainly a process of recovering after a hair transplant. And then it's a wait and see game in terms of really seeing the results come in.
You had mentioned see someone local because for complications, what are the most common complications that you see with hair transplants?
Scabs, they can get irritation of their scalp. They can develop sensitivities in areas where extractions occurred. So sometimes Botox needs to be injected in certain areas to remove any pain. So that's why I'm not a huge fan of patients flying in, like, especially from far distances, unless I know that I have colleagues in those areas of the country where I can send those patients to. The other issue is because I perform FUT on patients where I suture the back of the scalp and I put staples in, those staples have to come out 3 weeks later. And so I absolutely do have patients who fly back. In fact, I have a patient from well, that's in Palm Beach, but the point of the story is that there are patients who have to fly back into where my practice is to remove the staples, and so that's why I'm always in the camp of go to someone local. I think that's always a better move instead of trying to fly across the country or to a different state. There's absolutely excellent hair surgeons in every region of this country, so it's something just to think about.
And I imagine you want people to stay on that medical therapy that they are on during that 6-month, 9-month period, right? Because we want that fertilizer.
I want patients to stay on hair loss medications as long as they can. And in fact, this is what I say to patients. If you don't have a side effect from the medication or a medical reason to stop the medication, then you continue to take the medication. I actually am in the camp that these drugs can be microdosed. So, interesting enough, there was an article in the Wall Street Journal about how telehealth companies like Roman, Hims, and Keeps have been overprescribing finasteride, which is considered to be one of the most prescribed medications for hair loss around the globe. But the problem is that there's not enough oversight. And because there's not enough oversight, a lot of these medications are haphazardly being prescribed. There's little oversight. And in fact, there are many individuals developing side effects when they shouldn't really be developing side effects from these drugs because they're fairly safe. And so I'm in the camp that these drugs can be microdosed. What I mean by microdosed is they don't necessarily need to be taken every single day. And we know, for instance, that finasteride and dutasteride can stay in your system for weeks as long as you get to a certain maintenance dose. So sometimes I put patients on these drugs only 2 or 3 times a week, and they don't develop those side effects that everyone's so fearful of.
Tell us, what are those side effects? I remember I read that article too. So
So with DHT blockers, side effects that men are concerned about are libido, erectile dysfunction, inner groin pain, gynecomastia, which is enlargement of male breast. There's really no concerns for females to develop side effects, but we have to be very diligent if they're premenopausal, haven't had kids yet. But I do feel very comfortable putting females who are not pregnant yet on these medications as long as they understand that they need to stop these drugs with 3 menstrual cycles before getting pregnant. And not a lot of physicians are comfortable doing that, but I am.
I'm glad you brought that up. I was going to ask you about it because I've now had patients come in and their friends, their husbands are on it and they read that and they're worried and they're concerned. And yeah, I think when used appropriately and dosed appropriately, taken appropriately, these medications can do wonders. So it is too bad that they are being prescribed maybe a little inappropriately without the oversight.
I think that's to both of our advantages because patients want to come to either and I always say this, go to your dermatologist, go to your hair surgeon. It's better to work with someone. I think, Dr. Mina, if you do have a patient who comes in concerned about side effects, don't start them on a daily dose. Microdose it. Start it 1 or 2 times a week. Let them know if you have side effects after a month, and then like stop it at 3 times a week. And I tend to never see side effects after that.
Same thing like with minoxidil too, like taking such a teeny tiny little dose, especially for women, is perfect and you don't see the side effects typically.
Well, women are concerned about one particular thing with minoxidil, and that's unwanted hair growth in areas that they don't want. And so, but that doesn't tend to stop them from taking the medication.
I was going to say, when I tell them that, they say, look, I already have that peach fuzz. I'm already getting those little dark hairs on my lower face. So I just want hair on my head. So usually that's not why they say no.
Those are really the drugs at our disposal: DHT blockers, finasteride, dutasteride, and then minoxidil. And again, it's all about microdosing these drugs appropriately for each patient based upon kind of their risk profile, where their comfort levels are, because these fears are genuine, and some people do develop side effects. So it's something to be cognizant of. But regardless, though, I am very, very, very adamant with my patients. And I've seen failures from hair transplants, and I correlate that with they weren't on medical therapy. And so I think it's critically important that patients are on medical therapy if they're doing a hair transplant. Otherwise, do not go for a hair transplant.
Right. It's probably a lot of time and money that, yeah, your chances of it working aren't high. Which, speaking of, how do you counsel people on, what is the success rate for hair transplants? Can you give us some numbers, or who does it work best for and who might be disappointed?
That's a great question. I have seen success in all my patients, but varying success. We always want our patients to have like these miraculous results. But when I think about success, it might be nothing to do with me, actually. It might be because they didn't have enough donor supply. They didn't have enough hair to transplant to the front. So I wasn't able to necessarily achieve the result I was hoping for. But I always make that clear to patients. Now, when should a patient absolutely not have a hair transplant? Well, this is why it's critically important to go to a clinician who can diagnose whether you have an underlying hair disease. Because if you have something called a scarring alopecia, and this could be a frontal fibrosing alopecia, FFA, which happens in postmenopausal women, you're not going to have a successful hair transplant. If you're someone who has trichotillomania, where you're pulling your hair follicles out, and that hasn't been addressed before the hair transplant. In fact, I actually just performed a hair transplant on a woman who has this condition where she pulls her hair follicles out, but she was counseled by me, doesn't have an underlying depression, that she can no longer do that. Otherwise, the hair transplant will not be successful. If they have an autoimmune disease like alopecia areata. So all these conditions have to be diagnosed properly. And I think there have been many failures because the clinician didn't have an eye for looking out for these conditions. And so again, this goes back to making sure that you go to someone who's reputable. Don't look at the price tag. Look at the competence of the clinician before you choose to go for a hair transplant.
This is not where you want to shop around for the best deal, right? The cheapest.
Unfortunately, no. Unfortunately, no. We all want the cheap deal, but complications arise when you look for bargains, and especially when it comes to surgery. You want to go to someone who knows how to manage complications because complications happen, and you want to go to someone who has the competence to weather the storm with you during surgery and after surgery.
That's what I say too. Like dermatologists, plastic surgeons, we all can have complications with things, but we know how to manage these things, right? Versus someone who doesn't have medical expertise. So that's a great point. Does it matter if you've been, balding for 25 years and you want to transplant? Is it better to do it earlier? The sooner the better. Does that impact it at all, or age?
I'm not in the camp that someone in their early 20s, mid 20s, even early 30s is really a candidate for a hair transplant, especially if they have progressive hair loss. We don't know how a young male is going to progress. And I think, unfortunately, we see too many of these young men going over to Turkey or internationally because they see a very cheap way to address their hairline. The issue is, when we think about hair loss, we have to think about it in terms of 20, 30 years. Where is that hair going to be? Again, there's a finite amount of hair in the back. So for a young person, I'm not really in the camp that you should have a hair transplant unless you've been on medical therapy for a couple of years and your hair loss is stable. If you're in your 40s, your 50s, your 60s, we kind of have an idea about where your hair loss is at that point. And as long as you're willing to be on some form of medical therapy to stabilize that position you're at with your hair, I feel comfortable performing a hair transplant. With a younger person, maybe it'll be a smaller hair transplant because we just have to be cognizant that hair loss is progressive. Someone who's older and in their 60s has never been on hair loss medications, we now put them on hair loss medications. I could be more aggressive because I kind of know where their donor supply is, and it gives me a little more confidence to move forward, being more aggressive. And then with females, we have a little more flexibility to perform hair transplants, younger women and older women. But again, with all those female patients, we have to make sure that there's no underlying medical conditions like PCOS, thyroid, diabetes. There's a lot to think about. And so that's kind of my philosophy in terms of how I think about transplants in different male populations and female populations.
Have you seen any effects with the semaglutides out there, the Ozempics, right? With people being on them. Maybe they had their transplant a couple months ago, now they're on it and they're having hair shedding, which we know is a different thing and reversible, but does that impact the transplant at all?
It's a great question. I was actually, before I jumped on the podcast, I was writing a YouTube script for that exact topic.
You can practice with us.
Yeah. Well, what we do know is that when you lose a significant amount of weight rapidly, that can lead to hair loss. It's called telogen effluvium, temporary hair shedding. I wouldn't actually call it hair loss because it's kind of shedding. Your body has an insult to it. Even though you're losing weight, it's considered an insult to the body. But long term, I'm in the camp that it's actually good for hair loss because you have a less risk for diabetes. You're healthier. You're getting more nutrients and oxygen to the hair follicles. So that's kind of the dichotomy around taking these hair loss medications. And then what happens if we reverse and we stop using Ozempic or Ugavi or any of these medications? Well, one can argue that it would have the it would have a negative impact long term on the hair. But I do think long term Ozempic, all these weight loss medications actually help promote hair growth.
Yeah, but just kind of lowering your body density and all of that, just being healthier, right?
Absolutely. So, would I encourage you to take Ozempic before surgery? Is that the question you're asking me?
If someone came to see you and they're like, "Oh, by the way, I'm gonna start Ozempic," do you say like, "Ah, you try to wait," or do you say, "Yeah, go for it"?
I've not been faced with that question directly. I guess it would really depend upon what their current weight was. If I thought they were going to be losing 40 pounds or 50 pounds in the next 6 months, I might be a little more cognizant of maybe we should hold off on the hair transplant. But if they're at a certain weight and I think maybe they'll only lose 15 pounds with that Ozempic, maybe I feel a little more comfortable.
I think this is something, again, I'm just curious, right? This is something that we'll probably have more answers for, right, in the next few years since, this is just kind of blowing up now.
Well, we absolutely know that patients have lost hair being on these medications, like at least temporarily. So it's something that patients are absolutely concerned about. But we also know there's a lot of benefits to these medications from a cardiovascular standpoint, from a health standpoint. So, hair. I always say to patients, hair is at the lowest area of the totem pole. For me, it's important, but it's really cosmetic at the end of the day.
It keeps me warm.
It keeps you warm. We know that hair is important for mental health. We know it's important for a lot of different aspects, but still, relative to all the other health conditions that we as humans develop, it's pretty low.
Yeah. Yeah, which is why it's like the first to fall out when it gets stressed.
Absolutely. But it also signals what's going on inside of the body. So that's why, again, I'm going to harp back on this. It's important to go to someone who looks at the body holistically because one could argue a hair restoration surgeon is only worried about cosmetics and making money, but very often I pick up on chronic disease from looking at someone's hair. And so you have to go to someone who knows what they're doing.
Absolutely. Yeah. That's how I feel about skin. People think, oh, it's just cosmetics. Like, well, actually, the skin and hair, right? And hair is part of it, is like a window to how your inner health is. So I completely agree. And yeah, you want to see someone who knows when there's actual disease of the hair follicles of the scalp, right? Because then you don't want to be getting a transplant. So it's important to make that distinction. What are your thoughts on things like PRP, exosomes? Is that something you recommend as sort of the maintenance or sort of fertilizer pre-treatment?
That's a good question. So let's talk about PRP. And I'm also going to talk about mesotherapy because I perform both. So PRP is platelet rich plasma. For those listening, this is where we take your own blood, we spin that blood down and we isolate growth factors and we re-inject those growth factors to the scalp. We know that it has benefit in helping to stimulate some hair growth. We know that PRP is very effective if you have an inflammatory scalp condition. What we don't know is the following. What we don't know on an individual basis is the following. When we take growth factors from you on a Monday versus a Friday, are they the same? When I take Dr. Mina's blood and I take my blood, are we going to have the same growth factor levels? And I doubt it. I think there's a tremendous amount of variability when it comes to PRP. And so some clinicians say they get good results. Some clinicians say they don't get good results. Some patients get good results. Some patients get great results. Some patients get no results. So that is one of the things that's very frustrating about PRP. And so I think the same philosophy, and this is my philosophy, applies to exosomes. I'm also in the camp, and this is very controversial, but I'll say it. I'm also in the camp that most dermatologists and hair surgeons, they went out and they bought these $20,000 machines to spin down blood, and they're wed to prescribing PRP, even though there are sometimes better options out there. And that's where mesotherapy comes in. I am in the camp that mesotherapy is a lot more effective for addressing androgenetic hair loss, which is what PRP is usually used for anyway, unless you have an inflammatory scalp condition. And when I perform mesotherapy, I inject. It's the same process where we use these microneedles and we do 100 to 200 injections across the scalp. I use dutasteride commonly, sometimes minoxidil, but I find dutasteride to be the most effective. Um, and I use that in both men and women, and I see great results. And what's great about mesotherapy is we know exactly what we're injecting. We know that this has been tested on millions of people. We know that it's used for hair loss, and we know it's effective.
Yeah, is it kinda like microneedling and then you spread the dutasteride on?
Nope, it's loaded into a syringe, okay, and it's injected with these little micro needles that are supposed to go down to the hair bulge and activate the stem cells, which is the same process of what you would do with PRP. So I'm in the camp that mesotherapy, and interesting enough, I make less in my practice prescribing mesotherapy than PRP, and we charge the same amount. And I'm always in the camp of telling patients to do mesotherapy over PRP because I think it's more effective. I think you get a bigger bang for your buck. And I think that most of the dermatologists are wed to using the PRP because they bought these machines that are very expensive and they have no choice.
I don't know about $20,000 for a centrifuge.
Well, there are centrifuges that rent. Obviously, and that's the other issue with PRP. That you bring up another good point. There are centrifuges that are $800. There are 1,500. There are $20,000. There's so much. The protocols for PRP are all over the place.
There is a lot of variability for sure.
How many times do you do it? How many times? At the end of the day, here's the most important thing. I still perform PRP and I do mesotherapy. But regardless of whichever you choose, it's about consistency. So my protocol in our office is we do month 1, 2, and 3, and then every 3 months. You could stop, but we always tell the patient that your results will incrementally take a step function downwards.
Yeah. Well, that's awesome. I definitely will look into mesotherapy at my next conference. And yeah, I agree. We know there are good studies to show PRP with hair can help. However, you totally hit the nail on the head. There's so much variability, your age, how recent was the hair loss, and all of that. So you bring up great points. And hopefully in the next few years, we can address those a little bit better. So this has been a lot of fun. I have personally learned a ton about hair transplantation. Can you just leave us with your top 3 tips for someone considering a hair transplantation?
Yeah, number 1, do your research. So spend a lot of time looking through social media, Google, reading up on the procedures. Come in very informed, ready to ask questions. Number 2, do not go for a hair transplant unless you are considering or already on some form of medical therapy. And number 3, have realistic expectations. Don't think that you're going to necessarily achieve that youthful hairline that you had when you were in your 20s. We can, restore the hairline, the mid scalp if you're a male, but maybe we can't address that crown because you just don't have enough hair. So realistic expectations are critically important.
Yeah, gosh, great advice for so many things, right? I know people are going to want to find you, follow you if they're in Palm Beach and New York, maybe come see you. Where's the best place for people to follow you and find you?
So if you're on social media, you can find me at Dr. Ross, doctor spelled out in Ross. I also have a podcast called The Hair Doctors that I co-host with 2 other hair surgeons. And I'm on YouTube. So Dr. Kopelman on YouTube, and I release weekly videos on hair transplants, hair restoration. And so again, it's all about education. And I encourage you all to try to become as educated as you can before you go for a hair transplant.
Great advice. So amazing. I really appreciate you being here and thanks so much.
Thank you so much. This was great.
All right. We'll see everyone next week.